recently started one of our largest projects last September, which was about 180,000 square foot medical office building we call a medical services building that is attached to the hospital at Silver Cross Hospital in New Lenox, Illinois, which is in the southwest Chicago suburbs. And that project really reflects, I think, where a lot of the healthcare market is going. A big portion of the building, 80,000 square feet of the building, is occupied by the hospital, and they're moving outpatient services that they used to provide inside their hospital now into the attached medical services building that we own. They can have us own it, lease it back to them at a much lower cost than they could have done if they'd have put it into their facilities. So one of the trends that we're really working with and growing there is that hospitals want to use their capital really on their acute care facilities and the things that they need to do to employ physicians and to grow their core business. The medical office buildings are no longer really considered a part of that core business, so that's something that having third-party developer capital involved is advantageous for them, and we provide a low cost of capital to do that. Then the other kind of part of that trend is that then have the right tenant mix made up of the balance of the building that will complement and feed the services that the hospital is providing both at the acute care level in the hospital as well as their services that are being provided in our building with their imaging equipment and those types of things. So we have had a very successful lease up of that building in that structure, and I see that as a trend that will continue on a lot of our on and off campus buildings.